When I had my breast reduction surgery to relieve back pain, the doctor looked directly at my husband and asked him, what size would he prefer? My husband, being a wise man, replied that the size should be whatever would eliminate my pain. Just last year, after being diagnosed with brain cancer, I met with the doctor to discuss the diagnosis. The first thing he said, in a passive-aggressive tone, was, "So I hear you've been consulting another doctor." That same morning, we met with the other doctor, and later that day, we created a pros and cons list on our whiteboard. By the end of the day, we decided to stop seeing Dr. A and switch to Dr. B. It's a decision I haven't regretted for a single moment. As a child protection worker, I received a report about a child who had been slapped so hard that the mark was still visible days later. I instructed the caregiver to take the child to a pediatrician for evaluation. The doctor later called me and remarked that the child had misbehaved in the office and said he understood why the grandfather lost his temper and hit him. I later found out he even made this comment to the child. The child wasn't bad. He had just experienced so much trauma that he reacted inappropriately at times. As a teenager, I went to my doctor to get birth control pills. She told me I should also start taking prenatal vitamins in case I accidentally got pregnant. If I was there for contraception, why would she assume I'd want to keep an unplanned pregnancy? I went to see a doctor about my knee pain, and her first comment was, "If you weren't overweight, your knees wouldn't hurt." I'm not overweight, and she didn't even examine my knees. Instead, she offered me diet pills as a solution. In college, I suddenly started having daily nosebleeds. Concerned about how often they were happening, I went to the campus health center. Without examining me, the doctor claimed the dry air was to blame. I explained I had never experienced frequent nosebleeds before, and that the college was in the same climate as my hometown, but she kept insisting it was due to the dry air. When I became frustrated, she said, "I don't have to treat you, so if you don't calm down, you'll have to leave." Reluctantly, I composed myself, and she performed a physical exam, but still maintained it was the air. Later, a specialist diagnosed the real issue, an enlarged blood vessel. He cauterized it, and the nosebleed stopped. During a routine EKG, the technician told me, "Sorry, the machine's malfunctioning. If this were your actual heartbeat, you wouldn't have long to live." Moments later, we realized it was, in fact, my real heartbeat, which showed frequent asymptomatic skip beats, PVCs. Thankfully, it was easily addressed with a minor ablation procedure, and I've been fine since. However, her words haunted me every waking moment during the 6 weeks I had to wait for my cardiology appointment. "You're a Marine. You're supposed to be tough, so stop crying," said the male doctor as he performed a cervical biopsy with his hand inside me. After I shared that my social anxiety made it hard to answer phone calls, the doctor laughed and said, "A young woman like you shouldn't waste her life being depressed and anxious. You need to get over it by now." His words left me feeling awful. "You're a mother now. Get over it," said an OB-GYN when I complained about feeling constantly exhausted and perpetually cold after giving birth to my son. I was working over 40 hours a week while my husband worked more than 60, leaving me to handle most of the childcare and housework on my own. I was so drained that I relied on 12 or more cups of coffee daily to function, yet no matter how many layers I wore, I couldn't stop shivering unless I stood under direct sunlight or took a hot shower. It took 5 years to realize that this wasn't normal. The constant fatigue and freezing sensation were because my thyroid had essentially shut down. Once I started medication, things improved significantly. At 32, I sought a referral to have my tubes removed, which is permitted after 30. The doctor laughed and told me I was too young to decide about my reproduction. He said I should wait to meet my future husband because I'd love him so much that I'd want to give him everything, including children, and I'd regret my decision. Later, I suffered a bowel obstruction due to an incorrect meal served at a restaurant. The pain was excruciating, and I was taken to the hospital and referred for a CT scan. However, the next doctor dismissed it as nothing without even examining me closely and sent me home. Days later, another doctor found that the obstruction had blocked my urinary tract, leading to pyelonephritis, an infection causing inflammation in my kidneys. My psychiatrist dismissed me by saying, "It's all in your head." Well, of course, it's in my head. That's exactly why I came to see you. When I was 15, my mom took me to the gynecologist, who asked me to step on the scale to check my weight. After glancing me over, he said, "You're underweight, but that's fine. It suits you. You're very attractive like this." At the time, I was battling an eating disorder and was starving myself. I had an abscess in my armpit, but the doctor refused to state me for the drainage procedure. When he inserted the needle into the painfully swollen and inflamed area to numb it locally, I winced and made a sound of discomfort. In a condescending tone, he said, "What? I barely touched you." On another occasion, I mustered the courage to ask my family doctor for a referral to a therapist for mental health support. He dismissed my request, saying, "No, the wait list is about 6 months, so it's pointless. If you need someone to talk to, just talk to me." My best friend's bra size went from an A cup to DDD within a year, causing severe back pain. When she sought a consultation for breast reduction surgery, the female doctor refused, stating she wouldn't consider it for someone so young, 19 at the time. She added that decisions regarding her breasts should include her future husband, even though my friend wasn't even dating anyone. During a conversation, I was asked if I'd ever been pregnant. When I replied no, she corrected me with, "Not yet." Excuse me, but no was an accurate answer. While I know her response was sexist, I can't help but hope she uses the same logic for everything else. Never had bone cancer? Not yet, D. I visited a new OB/GYN, and during the examination, I felt a strange but not painful sensation. When I asked, "What are you doing?" she replied, "I'm tilting your uterus. Some women find this pleasurable." I was left wondering if I'd been violated. That was my last appointment with her, and in the 15 years since, including during childbirth, I've never had another doctor perform that maneuver. "I'm not hurting you," said the dentist, despite causing me pain for about 10 minutes before I finally reacted. She had perforated a perfectly intact tooth. "You're just stressed and overweight. Get in shape and go on some nice dates. You're still young." That was the advice I received from a doctor when I went in with symptoms like hair loss, brittle fingernails, joint pain, brain fog, and rapid, unexplained weight gain. It turned out to be my thyroid, which could have been diagnosed with a single blood test. Ironically, I only got the test after starving myself for months to try to lose the weight. The delayed diagnosis continues to cause me problems to this day. At 23, my OB/GYN told me I needed to have children soon or I'd run out of time. I was single, still in school, and unemployed, but he refused to change my contraception despite my circumstances. During my first and only appointment with a neurologist, he confidently claimed I was repressing memories of abuse by my father and told me I needed to explore it further. I had gone to him for symptoms like vision loss in my right eye, tremors, and numbness on the entire right side of my body. For the record, my dad wasn't around much while I was growing up, but when he was a great father. I switched primary care providers, saw another neurologist, and finally got a proper diagnosis of complex migraine after undergoing several tests. Although I still experience vision loss, I've learned to sense when it's about to happen. I developed severe acne when I was 8 years old. By the time I turned 13, I saw a dermatologist who suggested I go on Accutane. For those unfamiliar, Accutane is effective against acne but comes with serious risks, including liver damage, which requires regular blood tests during treatment. I voiced my concerns about the side effects, but the doctor replied, "Well, if you don't take it, you'll just be ugly forever." Humiliated, I ended up taking the medication, but it didn't cure my acne. Being called ugly by a medical professional at 13 left lasting damage. Over a decade later, whenever someone calls me pretty, I still replay that moment in my head and struggle to believe I'm anything other than hideous.